Welcome to Breathe California. Terry Trumbull, a member of the board of directors. Our guest today is Estelle Coleman, who's been working for Breathe California for the past 8 years on a wide variety of programs to help people with breathing difficulties. So we're your healthy lungs people at Breathe California. Come back and we're going to talk about how tobacco and air pollution injure your lungs and all the different programs that we have at Breathe California that 140,000 people took advantage of last year to help breathe easier. We'll be back with Estelle in just 30 seconds.
The nice thing about Better Breathers Club is we go in and there's other people sitting around with oxygen. It's almost a relief that everybody looks the same in the room. It's a funny thing to say, but it's a good feeling. Breathe California means having resources available to us that will help guide us and make our lives easier.
Welcome to Breathe California. I'm Terry Trumbull, chair of our Environmental Health Committee. At Breathe California, we work to try to help people with breathing difficulties. These difficulties are caused by tobacco, air pollution, and other forms of irritants. Today we have an expert, Estelle Coleman, who's been working for the last 8 years for Breathe California on a variety of programs. Welcome.
Thanks, Terry. Thanks for having me.
So what do you work on for Breathe California?
Well, right now, for the last year, I've done the Better Breathers Group Club meetings, and those are for people with COPD, asthma, emphysema. Some of our attendees are on oxygen. And we meet in Palo Alto the second Monday of every month. We meet every other month in Morgan Hill, and we meet every month and the last Monday of the month at our office on Park Avenue, right.
And if you want to go to any of these meetings, the website will pop up later, but it's nothing very clever. It's lungsrus.org, and you can find out when the meetings are. So you mentioned COPD. What is that?
Chronic obstructive pulmonary disease. It's caused by smoking. Asthma can lead into COPD, and it's the fourth leading cause of death in the United States. Not only in the United States, probably all over the world. But most people who have it eventually end up using oxygen 24/7, which is not very comfortable. But we have a lot of different groups that we meet with, and we have a magazine, COPD. I have been reading not the latest issue, but one of the issues, and I was very surprised when I read that it is the fourth leading cause of death. Most of them are seniors, and we have a great program. We get great speakers to come in, and my main concern right now, Terry, is that we're losing a lot of people. And our attendance has dropped in all three groups, and I am trying to talk to them and to bring in their spouse if they have one, bring in a friend, to get them interested in the group and get the speakers. Sometimes it's difficult to get speakers to come, and we can't always get the same speaker for the three groups because of the different areas. But we've had some wonderful speakers. Last month at one of the meetings, we had someone from the fire department. And she spoke for a while, and then she had three firemen come in, and they talked about different health issues, and they had the fire engine with them so that the members could go out and inspect the fire truck if they felt like it.
Well, about 40% of the public has breathing difficulties, so it would seem to me that your program really makes a lot of sense. Do you have any sense of what the reasons are? It can't be because we're having less people with the problems.
I agree. There are more, and probably, hopefully it's not that they're not aware of it, because we do a lot of advertising. But, and I make courtesy calls the Friday before the meetings to remind them to come. and tell them who the speaker is if it's someone they're interested in. I'm concerned because maybe they're not interested sometimes, and I don't feel comfortable saying that, but I really don't know the main cause, but we're losing speakers. Some of them, is in my case, I'm no longer able to drive, but a lot of them don't drive. I use outreach, and I've suggested that. And a lot of them probably just don't get around much anymore. And that might be another reason. Sometimes they're not interested in the speaker. I can understand that. But I try to counsel them every month and come and talk to other people who have the same problem that you do. And I know sometimes that helps. And a lot of them come just to get out. There are a lot of things that we have to deal with as we get older. And like my children talk to me about going to senior citizens facilities. I don't like senior citizens facilities.
Yeah,
but
my mom couldn't have resisted more.
Really?
Yeah.
But we need to get out more. We need to get the fresh air. We need to have the companionship. And when I call them, a lot of them I talk to that I haven't seen, and I say, would you prefer I not call? Oh no, I look forward to it. And I realize they're probably lonely. Yeah. And I live alone, and I go through those periods too. But I just want to get the public more interested in it because their speakers are fantastic. And I think they will really enjoy it.
So what do you do, if anything, to try to find the people that newly develop these diseases? You know, they're a product of tobacco smoke or air pollution, and clearly people are developing the maladies, COPD, from those all the time. So the new people, any way of finding them?
Well, Janet, who's working now at Breathe California, rewriting a program, she's been doing some of that, going to different facilities, hospitals and nursing homes and places, and trying to get new members. I have not done that, but I think I might suggest that to Margot, that maybe I could do a little bit more to get more people, because it really concerns me that fewer people are coming. I realize with old age, there are the vicissitudes that we have to put up with every day, but maybe they're not able to come, and maybe that's why they enjoy when I call. You know, we have 5-10 minute conversations sometimes, and I realize being alone does not agree with everyone. So I would like to get them to come out more. We've lost some of them because of death, and we've also lost several because they're ill and not able to get out. One thing that's I think you'll find amusing is in the Palo Alto group, we have a lady who rides her bicycle to the meetings every month, which I think is fantastic. Yeah. But she's there bright and early. Sometimes she gets there before I do, but she's a model. Yeah. You know.
Well, it's absolutely imperative, no matter what age you are, to get out and get some exercise.
Absolutely.
My mom was having falling problems, and then went into a ditch in the car. It was hurt, but not her, and so we finally talked her into assisted living, and she's now in heaven.
Wonderful.
Because of all of the things you're talking about.
Exactly.
You know, she was in a home designed for a family, and she did play cards with friends a couple of times a week. But now she can leave her apartment whenever she wants. She can be solo, or there's always a group there to play cards, or you know, even sit on TV and make
have
remarks.
company.
Yeah.
Exactly.
So it really works quite well to do that. Well, tell us a little bit about your background. 8 years, my sneaky suspicion is not the entire life of Estelle Coleman. So
no, I was born in North Carolina. on my grandmother's tobacco plantation,
Yeah.
which, of course, now hasn't been in business for quite some time. At the age of 8, my mother and I moved to Boston. I had an uncle who came down to spend Christmas with the family, and since my mother and father were no longer together, suggested that my mother come home with him and he would get her a job. So I grew up in Cambridge, Massachusetts, and when I got married, I moved into Boston. I have 5 children. I did not work until all my children were in school all day, and then I got a part-time job. And after a divorce, I started working. A friend of mine got me a job in a bank, and I didn't know a thing about banking. But later on, I moved to, went to visit a friend in New York, and decided all my children were in either high school or college. And I got a job in a bank in New York, the oldest savings bank in the country, the New York Bank for Savings. I went to the American Institute of Banking and New York University, and worked myself up to become an assistant vice president. In 1980, the bank was going under, and I had talked to a friend who was moving to California. She had been recruited by Crocker Bank, and she wanted me to come with her, but I was going through promotions every year, and I was very happy where I was. So I waited until 1980, and I moved to California. And I was working for Crocker Bank until I retired. Crocker went under and became
Wells Fargo, I
well,
think.
no, became Home Savings,
Okay.
and then Wells Fargo for a short period of time, but Home Savings. So I got a job at Home Savings, and I retired from Home Savings right after they became Wells Fargo, and then which is now Chase. I remember Chase because in New York it was called Chase Manhattan.
Yeah.
So 35 years in banking, I think, covers part of the years that are missing.
Well, it's amusing because you didn't start working until your kids were in high school.
Right.
Yet you have a longer work career than most people are going to experience.
Right.
Do your 5 kids give you trouble for working now?
No, they're thankful and proud that I can do it, that I'm able to do it. And as I said, the 8 years that I started doing, what am I trying to say? Health fairs.
Sure.
And then I started taking classes, and Margot and the rest of the staff started training me. And then I started working with seniors, and I've always liked to work with people. So I worked with seniors until I could no longer work, and I asked Margot if I could keep the Better Breathers groups. So for the past 3 years, not 3, but for the past year and a half, I guess, I've been doing these 3. So I work like 2.5 days a month. And I had health problems and could no longer drive. And that sort of broke my heart because I've always been independent, and that just takes away so much of your independence.
Yeah, you associate having mobility and the
Exactly.
ability to go get into a car anytime with
Exactly.
independence.
Exactly. So I use outreach now and friends, and I still have one daughter out here, and she picks me up when we go grocery shopping or out to lunch or whatever.
Well, it's nice of you to buy groceries for. Our guest on Breathe California is Estelle Coleman. We're going to come back in 30 seconds and talk some more about how to improve your health and to make sure you can breathe easier for as much of your life as possible.
It's given me a chance to get out and be with people who has the same problem. and it helps you to manage your life better too, because you hear different things from each person, and it's just been really helpful in many ways.
Welcome back to Breathe California's TV show. Our guest is Estelle Coleman, who's been working the last 8 years with people like you to help you breathe easier or not develop breathing difficulties at all. Obviously, one of the major causes of lung and heart disease, cancer, and COPD, so that may be the 4 biggest diseases that you can develop, are smoking. Talk a little bit about Breathe California's smoking cessation classes.
I did the smoking cessation classes for about 4 years, maybe longer. And as I said before, I had to give it up because I could no longer drive. But I had success, I say, because I was able to, in talking with the people in the class and associate with them and get them to believe that they could do it. I had at least an 80% success rate in getting them to stop. I smoked for a very short period of time. I didn't like it, and a pack of cigarettes would last me all week, so that wasn't really smoking. And
But you probably still smelled like it.
right. But I know that people now in 2010 realize the dangers of smoking, especially around children, and it just bothers me so much that there are still so many people smoking. And the cost of cigarettes is just ridiculous. My children used to smoke, and we got them out of that. And I don't think any of my family smokes now. If they do, they're keeping it from me because they know I don't like it. But I wish that people, especially with children, around children and also around seniors, would consider their life and the life of the people around them and give up. It's not that hard to do if you're really sincere about quitting. It's also one of the reasons for COPD, which is another one of my issues. The people that I work with now at the meetings all have COPD. A lot of them are on oxygen, and they know that maybe smoking or some other lung disease caused the problems that they're having now. I enjoy going to the meetings and talking to the people. We have wonderful speakers, and I would just like to say to seniors out there, I wish you would look into a COPD meeting. You can call our office and find out more about the meetings. But the speakers that we have are not only for people who have COPD. They're for seniors and also not so senior, but they're subjects that we have to deal with every day. Last month at one of the meetings, at one of the groups, we had someone from the fire department. At another group, we had someone doing exercises. And I can remember when I did presentations at senior groups, the director of the group asked me if I would do some exercises. So I know how to do exercises, but I don't know the format. So I had every other person, I had them all stand, I had every other person take a step forward, and I made them up as I went along. But
I bet you did fine.
well, they thought so. And so there are so many things that we can do as seniors, and we certainly don't want to be walking around carrying our oxygen tank.
Yeah. No, I think exercise programs are marvelous. My younger daughter's second grade teacher had students do Tai Chi
Good.
every day, and
Good.
that was something, no matter what age you are, the movement is really worthwhile. So these things are quite spectacular. You mentioned one of Breathe California's programs is health fairs. What are health fairs?
An organization wants to promote a product, no matter what it is. Sometimes it's selling a product. They're fundraisers, and they're called health fairs, but they are fundraisers also. And so we have so much material at Breathe California that you just want to stand out and give it away on the street, because these are things that people need to read and have knowledge about so that they can pass it on to family members and friends and the general public. So we have a booth that we set up, and we have flyers that we give out. All the organizations do. And we have pictures of different groups, like our junior group. We have someone who has a program that works with children, school children. We have someone who, like I do, work with seniors. We have as I did the smoking cessation classes for seniors, we have someone who does smoking cessation groups with children. So a health fair it can be a number of things, and it usually is, and and I used to love them. But I can't stand for a period of time now, and you stand and greet the public and pass out the brochure and tell them about your product.
Well, I'm a lot younger than you are, so I've sat when I do health fairs.
Well, I always stand when I'm talking to someone.
That's really great. I'm much lazier. Generally, Breathe California has me go to health fairs for law firms because I'm a lawyer
I see. Okay.
by background. But it's amusing that at those health fairs there are more non-lawyer employees. There's a whole bunch of people that do billing and human relations or paralegals. They show up, and generally the lawyers aren't there.
Right.
But it's a spectacular opportunity. So one of the things you mentioned is we've been doing this whole conversation in English. Is there any chance that there are other languages that Breathe California can help people?
Yes, there are, but I'm not that familiar with them.
Yeah. Just to interrupt you, I was setting you up, but our brochures are in 27 different languages.
Exactly.
So if you want to learn about COPD, we can get you one in a variety of languages. Right. And I think that's one of the beauties of our program is that it's out there helping people no matter who they are. In a county in the census 10 years ago, every group was a minority. Caucasians were 48% of the population. You've got to be able to provide for people's needs. So one of the questions that might be impeding people that are watching is how much is Breathe California charging for all these programs?
I don't know. I know that the smoking cessation classes are $70. It's a 5-week course, and when I did them, it was at O'Connor Hospital and El Camino Hospital, and I also did 3 or 4, I think, private facilities, high-tech facilities. I went to them to do the classes. Going back to language, Terry, I know that we have them in Chinese, and we have them in
I'm pretty sure Vietnamese, Spanish.
Yeah, right. We have the folders on our tables to pass out to the different people. And when I was doing facilitations at the senior groups, I would say it in English, and one of the members of the group would repeat it in the language that most of the members understood. So it was really great. It was an education for me and something totally different from banking. And I loved it. I thought I had the best job in San Jose because I worked by appointment. And if an organization wanted someone to come in and speak, they would call the office, and the office would call me, and I'd call the person and set an appointment. So I worked by appointment.
How about Better Breathers? Any charge for those programs?
No.
Yeah.
No.
And those brochures, there are hundreds of brochures in all these different languages. I assume, they're $5 a piece?
No.
So they're free. You could walk into Breathe California's office or go to a health fair and
Absolutely.
yeah.
Absolutely. And the people who come to our meetings bring a lot of material with them. And like the fire department last month, they had a ton, and they had little shopping bags to put the material in. One of the things I'd like to talk about is, and I don't know how many people know this is available, they have a little, it's a little paper cup, and there's a list on it of all the ailments that you can write down what your ailment is, check it off, put it inside the cup, put it in the refrigerator on the door. And there's also a little poster that you can put on the outside door of your refrigerator. So let the firemen know that that is, it's called a cup of life or something, I think. I can't remember.
So assist you if they have to respond to a fire.
Exactly, exactly.
Well, you sound like you're enjoying yourself. You found another new life and career at Breathe California.
I did. I loved my job as banking. And as I said before, I wanted to learn everything there was to learn about it because it was my job. And when I started with American Lung, I didn't tell you how I got the job.
Which is our old name. 4 years ago, we became Breathe California.
Right, exactly. Thank you
Yeah.
for reminding me of that because
and we've
I
only
still
got
do
about
it.
a minute left, so you can tell us
Okay.
quickly how you got the job and then give me a summary of what you want everybody to know.
I was talking to my son-in-law and my grandson, and I said, I want one of you guys to find me a job because I'm retired and I'm going crazy. And so, as you know, my grandson works for Breathe California. And he called me one day that they want Margot and Janelle. No, not Janelle. What was her name?
I've forgotten.
Anyway, they wanted to meet me. So I met with them, and that's how I started.
So, in summary, Estelle's a wonderful addition, typical of Breathe California staff who are there to help you so you can breathe easier and have a better, more healthy life. So feel free to call us at Breathe California, 408-998-5865, or go to our website, lungsrus.org. See you next week.